your student nurse today. May I verify your name and date of birth, please? Okay. Charlie 98839, allergic to latex, penicillin, and betadine. That's what I have here on my provider's orders. Great. Okay, so I've heard that you've been having a little trouble urinating. You haven't urinated in the past 10 hours. And the doctor has ordered a Foley catheter for you, so I'm just going to assess your abdomen area to see if that would be appropriate for today, okay? So let me just put my provider's orders to the side for now and get some gloves. Move you up. That should get out good. All right. Okay, let's see. I'm gonna roll this up for a second. All right, I'm gonna palpate your bladder, okay? Do you feel any discomfort? Yeah? Okay, it is a little distended. I'm looking at the vaginal area. I identified the meatus. I don't see any redness, swelling, lesions, discharge, anything like that. And I know she just had prenatal care, so that doesn't need to be done right now. Okay, so Mrs. Knight, it will be appropriate to put in that catheter today, okay? So let's get you into position. So I'm just going to take your legs. Comfortable? Yeah? Okay. All right, Mrs. Knight will be right back with the supplies, okay? So I'm going to do some hand hygiene. Yeah. All right, so I have my provider's orders here. It is a 14 French Foley insertion catheter. I have that on my provider's orders. It expires in 2017, not an issue. It does not have latex, penicillin, or betadine in it, so she's all set there. It's intact. I have a flat dry surface, whoa, to perform all this on. So that will be good. I'm going to put my provider's orders just over here for a moment before I start my procedure. Okay, so I have this that I'm going to take out. Now I'm going to throw this away. Make a little trash bag. There we go. Okay, I'm going to start my procedure now. So I'm holding those 1-inch margins out, left, right, and towards me. Okay, and I'm going to move it to the side a little bit to give me a better angle. Okay, so now I have my blue drape here. Put that back a little bit. Take that, step back. Again, holding those 1-inch margins, walk it around, shiny side towards me, and we're going to lay it over the patient. Coming around her to not cross my sterile field. Okay, so it's gloving time. Pinch here, drop. I'm going to come around here, open this. Get under here and open. You better stay for me. There we go. Okay, so I'm just going to pinch the cuff. My non-dominant hand, step back, supinate. Dig under with my other one. Step back. Supinate. Good to go. I'm sterile. I don't need that anymore. And I have chosen at this time not to use the white drape, so I'm just going to pick it up right in the middle and set it right there. Okay? So now I'm going to move my box this way. I like it better like that. And drop that. Okay, so I'm going to remove my sheath of my catheter, making sure not to lose control, and drop that in the trash can. There we go. And I'll open my lubricant. And put the lubricant inside. Trash. And dip the end of the catheter in the lubricant. Okay, so that'll stay there for now. Now I'm going to take my hydrogen peroxide, tear it off. I don't know where the rest of my cotton balls went. That's interesting. Okay, well, I will keep going as if I have all my cotton balls, and I'll bathe my cotton balls in hydrogen peroxide. Usually they use betadine, but because Mrs. Knight is allergic to betadine, we're going to use hydrogen peroxide. So, wash that. Okay, so now I'm going to get my syringe and take the top off. The manufacturer says that we don't need to inflate the balloon or anything like that before insertion, so I'm just going to take this and there we go. And I'm going to insert it into the port. I'm verifying now that it is a 14 French catheter, holds 5 to 10 milliliters. Getting that ready for. Alright, so now we're good to go. I'm going to put this on top. Alright, so now I'm going to move my sterile field from here to, bye-bye. Alright, so I'm going to purposefully make this my dirty hand by holding open the labia, and I'm going to take my forceps and clean the vaginal area. So I'm going to do outer, around, trash, inner, around, trash, because, well, we're going clitoris to anus, by the way, so we're going middle, around, trash, because this is a used kit and I don't have 3 more cotton balls. Usually I would have 3 more cotton balls, so I'll just do it as if I did. So we're going to go outer, around, trash, inner, around, trash, middle, around, trash. Okay, so now I'm done with that. I'm going to put this in here. Okay, so now we're ready for insertion. I'm taking my catheter, holding it 2 to 4 inches away from the tip. Okay, Mrs. Knight, I'm going to insert your catheter. You might feel a little discomfort, but bear down for me, okay? So I'm going to insert it, making sure not to touch the labia there. I'm going to keep inserting it until I see urine. Okay, I see urine now. So I'm going to do 1 more inch of insertion and stabilize the catheter with my non-dominant hand. Take my syringe, inflate the balloon with the 10 milliliters. Alright, bring it over here. Alright, trash that. At this point, my sterile procedure is over. I'm going to give it a little tug. It's in there. Did you have any pain with that? Are you having any pain now? No? Okay, that's how I know that it's not in the urethra. If it were, she would have a good amount of pain. So at this point, I would take my bifurcation here and attach it to her leg with the device that came with the kit, not tape. And then I would take my bag and attach it at the bottom of her bed on the specified hook, not on the handrail. We would not want that. Okay, so at this point I would assess eyes and O's. I would, every shift, I would also do perineal care every shift, catheter care every shift, and document the procedure, which I'm going to go ahead and do now.